steps of IVF treatment. The first step is the egg stimulation, the ovarian stimulation. There's a follicle pool in the ovaries. We give some injections to you and then we help you grow follicles. This is the initial step of IVF. The second step of IVF treatment is egg pickup. We just, under small anesthesia and sedation and analgesia, we just pick up the eggs. This is the second step. The third step of IVF treatment is producing the embryos. We get the eggs, we get the sperm cells, and in the laboratory under a microscope, we do the fertilization procedures, which is called microinjection. Afterwards, we have some embryos. The fertilized eggs are called embryos. This is the third step. The last step of IVF treatment is embryo transfer. In some cycles of IVF treatment, we do the transfer at the end of these 3 steps. In some cycles, when we produce the embryos, we freeze them and we do the transfer in another cycle. This is called embryo freezing. In IVF or in fertility treatments, we can freeze the eggs, we can freeze the sperm cells, or we can freeze the embryos. What we are talking about is the embryo freezing for today. If you have already had your embryos frozen, those embryos are stored in IVF laboratory under your identity and your husband's identity, and they're kept and stored under your knowledge and under your permit. If you let us store them, we can store them for many, many years. If you're planning to have babies, some of these stored or frozen embryos are thawed, unfrozen, and then they are just checked in the laboratory once more. If they are viable, if they are alive, then we do after the thawing process, the embryo transfer. Thawing and transfer procedure needs endometrial preparation. The embryo is ready to be thawed, to be unfrozen, but your endometrium or your uterus has to be ready for transfer in order to get pregnant. There are different ways of preparing you for a freezing, thawing, embryo transfer process. In some cycles, we do it natural cycles. We follow up your egg. When you ovulate, we just know the date of the implantation, then we thaw the embryos and we transfer it to you. This is natural cycle. Most commonly, we use hormone replacement cycles. At the start of the menstrual cycle, we give you some pills that thickens your endometrial lining, and then we just start the progesterone pills, and then we do the embryo transfer. This is hormone replacement treatment for frozen embryos. The other one is stimulated cycles. We give you pills or small doses of gonadotropins to stimulate 1 or 2 follicles to grow. And then when the follicle is ready to rupture or when you ovulate, we start the progesterone pills, we do the HCG trigger, and then we do the transfer of the embryos. This depends on the doctor's preference and also according to the patient's menstrual cycle status. All the 3 different ways of preparation for frozen embryo thaw cycles has the same success rate, so your doctor will decide which is best for you. Not all the cycles require embryo freezing, or in many cycles we cannot do the embryo freezing. But the necessity of freezing the embryos comes from sometimes from the start, sometimes at the end of the cycle. From the start, if you're having polycystic ovarian syndrome, if you're going to develop many eggs, you have a risk of ovarian hyperstimulation syndrome. In these cycles, from the start, we decide to freeze all the embryos at the end. And then we do the transfer in another cycle. When we start the IVF treatment, before the treatment, we do an ultrasound, we plan a treatment for you. But in some cycles, this might change at the end of the egg pickup. If during the cycle there is an endometrial pathology in the inner lining of the uterus, which is called a polyp or udder-like structure, detected at the ultrasound in the mid of the cycle, then we need to freeze the embryos, because if we do the transfer with an endometrial polyp inside, you might have a negative result. This is one of the other causes of embryo freezing. Or during the cycle, we do the ultrasound in accordance with the hormone levels. If your progesterone levels are high or getting higher during the stimulation cycle, then we need to freeze the embryos, because with the progesterone more than 1.5, then it's hard to get pregnant. So in order to not to have a negative result, we freeze the embryos and we do the transfer in another cycle with better hormone levels. If we're planning to do a genetic IVF cycle, if we're planning to do embryo genetics for any cause, then we usually freeze the embryos. At day 5, we do the genetic analysis, we wait for the results, then we do the embryo transfer in another cycle. These are 4 major reasons, indications for embryo freezing, but there might be other reasons for you to have embryo freezing, or you can have embryo freezing now, depending on your preference, because you're not wishing to have babies now. You just want to keep the embryos. When you want to have the babies in the next year, the other year, you can have the embryos transferred to you. This can happen also depending on your preferences. The freezing of the embryos has been done for many years in IVF clinics now. There are now vitrification and ultra-rapid vitrification methods for embryo freezing. We well know that these type of treatments of freezing embryos works very well. The fresh, unfrozen embryos, fresh cycles we call them, and the frozen embryo cycles end up with same rates of pregnancy. In some cycles, so you can know that not every cycle needs a frozen embryo transfer. You can have it in fresh or in frozen cycles. Your success rates will not change. The regulations of IVF clinics is very strict. In Turkey, under law, the embryos are frozen under the knowledge of mother and father, the women and men, and they both have to sign the papers to have a frozen embryo cycle. Those embryos cannot be thawed, cannot be unfrozen without the knowledge of both partners. So those embryos are yours both. So if you decide together to unfreeze the cycles, that's the only way to have an embryo transfer after frozen cycles. If one of the partners doesn't want to have a child or doesn't want to have those embryos to be used or to be transferred, the other partner cannot have or achieve those embryos. So this decision under law is by both partners' approval. This is required and you need to sign forms for that. It is very safe in this bank storage, and it is just checked by the Turkish Ministry of Health. It is regulated by Turkish Ministry of Health, and those embryos are approved to be yours, and they are stored in special tanks, minus 196 degrees centigrade, nitrogen tanks, and they are under your name, tagged under your name. When you have your embryos frozen in an IVF clinic, you can have the embryos, transport the embryos to another IVF clinic in Turkey, anywhere in Turkey. If you want to move your embryos from one clinic to another, it's also possible. But if you want to move your embryos from Turkey to another country, it's a little bit conflicted, because that needs a small nitrogen tank which cannot be taken to a flight. You need to move the embryos by a car, and it's a little bit problematic. And there are some private companies help you carry these embryos, but it's usually very hard to do it. If you have your embryos stored in Turkey, it's better to use them in Turkey, but you can use them in any clinic in Turkey. You can move from one clinic to another under your approval. This can be done. Endometrial preparation for frozen embryo transfer is very easy. It doesn't take a long time. If you're living abroad, if you're planning to come for your embryos here for transfer to Turkey, if you call us before a few months, we can help you in your country. We start with the ultrasound and the blood test in your country, and then when you come here, you're already ready for the transfer. So 1 week here is okay for embryo transfer. But if you want to do everything here from the startup, you come here with the first day of the period, and then we start you some pills or ultrasound follow-ups. It will take like 15 or 16 days up to embryo transfer. Up to 16 days estimated, you will have the embryos transferred. Then you need to stay 2 to 3 days here, then you can fly back. It's not a long period and it's much easier, but we can make it easier and quicker for you if you call us before you're planning to travel here.